Hello everyone, my name is Nyla Hawkins and today I will be discussing the Chedoke Arm and Hand Activity Inventory, otherwise known as the KAHI. So what is the KAHI? The purpose of this assessment is to evaluate the functional ability of the hemiplegic arm and hand to perform tasks that have been identified as important by stroke survivors. However, it is important to note that it is not designed to measure the client's ability to complete the task using only their unaffected hand, but rather encouraging bilateral function. There are four versions to this assessment, version 7, 8, 9, and 13, but for the purpose of this video, we're only going to focus on version 7. So now in this slide, we're going to talk about aspects of the KAHI. As I mentioned before, it's an assessment measure. It assesses activities of daily living and upper extremity function. In order to administer this assessment, you would need paper and pencil. The diagnosis/condition for this assessment is stroke recovery, but it's not limited to clients with stroke. It would take about 30 minutes to administer. The attended population for this assessment would be upper extremity paralysis and stroke, inpatient and outpatient. And the age range for this assessment would be 13 years of age to 91 years of age. So now we're going to discuss administering the KAHI 7 version. The original KAHI consists of 13 functional items that involve both upper limbs and incorporates a range of movements and graphs that reflect stages of motor recovery following a stroke. So the equipment required for this version would be a height adjustable table, a chair or wheelchair without armrests, a jar of coffee or peanut butter, a push button, telephone, ruler, paper, pencil, a plastic pitcher, a plastic cup, a washcloth, a wash basin, a pull-on vest with 5 buttons, or a sweater with 5 buttons, and a bath towel. As far as setting up and instructions, the standard starting position for the client would be seated in a chair without armrests, as I stated before. The OT should always encourage the client to sit in a straight up posture with feet flat on the floor. The height of the table needs to be at the level of the last costal rib. The client's elbows need to come to the edge of the table, and their hands need to be resting on top of the table. It is also important to explain to the client that some tasks are difficult and they should not get frustrated if unable to complete all the tasks. Always encourage the client to give their best effort using both arms and hands. The client may attempt each task twice. It is also important to note that every effort should be made to ensure that the client understands the task. So each task should be demonstrated once, twice if needed. The client may be cued to use both hands twice, and the client may be reminded not to rest their elbows on the table twice. The tasks included in the KAHI 7 are opening a jar of coffee or peanut butter, calling 911, drawing a line with a ruler, pouring a glass of water, wringing out a washcloth, buttoning up 5 buttons, and your client drying their back with a towel. So now we are going to discuss scoring. For each task, you score the client or patient in 3 ways. First, the examiner uses the task component chart to identify what part of the task the affected limb performed. So for example, the affected hand turning the lid, or did the affected hand stabilize the jar? Secondly, identify the specific components of manipulation and stabilization the affected limb completed. Lastly, you are going to score the client or patient on a 7-point scale. So these ratings would include complete independence, modified independence, supervision, min assist, mod assist, max assist, and total assist. For each task, examples are given for each rating. You then add up the score for a total score to compare at a later date. Now we are going to get into the video demonstration.
So Alexis, what I want you to do, and I'll do by demonstrating, is you're going to open this jar of peanut butter and try your best to use both hands. Okay. So in this part of the video, I'm demonstrating what I want Alexis to do. And I will do this for each task from this point on. If you need it, but good job. Okay, now I'm going to demonstrate calling 911 on the phone. Okay. So here we go. 911, like this. So as you can see here on the calling 911 task, Alexis is obviously at complete independence. So I would score her a 7 on the score form. However, scoring is not the important part of this assessment. What we are heavily focusing on in this video is Alexis using bilateral function. Across the paper using a ruler. You'll do the same, like this. And you're going to try to use both hands. Here you go. Good job. And now we're going to pour a glass of water using this pitcher. I'll demonstrate for you. Like so. In the video, as we are completing each task, you can see the materials that are placed on the other side of the table. If you want to do the kahai with a client, usually materials are placed into a bag where everything is gathered, and usually it can be put at the bottom of the sink or in a cabinet. That's wet. What we're going to do is try to bring out as much water as you can, like this. And for our last activity, what we're going to do with this bath towel, we're going to pretend to wash your back off like this. It is important to note that in this part of the assessment, the task of drying your back, a client is usually going to use a bath towel, but in this case, I had to use a hand towel instead. So for this next activity, I'm just showing Alexis how to button up those 5 buttons, which is the last activity of the kahai. Good job.
So now we're going to talk about psychometrics. The kahai has good psychometric properties. The 3 shortened versions, as I talked about earlier in the PowerPoint, version 7, 8, and 9 of the CAHI were created to increase time and efficiency. And in the stroke population, they have demonstrated high inter-rater reliability. These are my resources regarding my assessment. Thank you everyone for watching my video, and I will see you in the discussion forum.